That's the one that just takes just a little bit to do, a couple of minutes each time, but it's done at the beginning of every term for every class, right? So if you haven't had a chance to do that, please do that. Okay. And then this week, let's see, what do you have your professional development plan due this week? Correct? Okay, so that's due Sunday, and we'll talk about that in a minute. The way I want to structure today is just introduce myself, tell you a little bit about the class, and then we're going to go through the orientation PowerPoint. And I'm sorry, but we have to go, every professor has to go through it with every class. So are you guys a group that are taking, most of you are taking Med Surg and Peds? Is that okay? So have you already had your Med Surg and Peds classes? Oh, I have a lot of no's, so surprise. So this will be the first time you're hearing the orientation PowerPoint. For those of you that have already heard it, you're just gonna have to kind of get through it, and I'll try and make it specific to this class. What else? So I want to do the orientation PowerPoint, then I want to go through the syllabus, and then go through the modules. Okay. So, why do we think, let me ask a question. Why do you think community nursing is placed? You guys only have one more term to go, right? So why do you think community nursing, oh, this is community nursing concepts. Sorry. I also teach in the PN program. I'm the course lead for PN, and they're called concepts of community-based nursing. So I've got to change shifts here. Monday I teach PN, Wednesday I teach RN, Friday I teach PN. So why do we think, I always love to get the answers to two questions. One is, why do we think this class is placed in your second to last term? Let me ask the first question. Let me ask another question first then. What do you guys think? Tell me what when you think of community nursing, what do you think about? Oh, come on, you guys. Come on.
Health,
let's go. I don't like to hear myself talk for an hour and a half. Go ahead. What do you think about?
I think of public health.
Public health. Okay. What else? Public health is the big umbrella. Community nursing is part of public health. So home health,
I would
right?
say I would probably say the breakdown of kind of going in depth into public health. So different ages, different cultures, stuff like that.
Yeah. What kinds of roles might a community nurse play? I'll start. I just retired last year from school nursing for 20 years.
Health department nurse.
Yep. Health department nurse, school nurse, vaccination nurse, hospice nurse, corrections nurse,
system,
corrections. Absolutely. Occupational nursing, right? Home health. What else? Immunization nurse, maybe an epidemiological nurse that works at the health department.
I know there's summer camp position, stuff like that.
Yep. Yep. It's care in the community. Okay, and so I really need you to look at this class with a totally different perspective. Okay, this class does not have a clinical, does not have labs, does not have SIMS. Okay, we are moving our care from the hospital or inpatient setting into the community. Just think about the community you live in now. How do all the people that don't require a hospitalization but have issues, chronic illnesses, vulnerable populations, mental health issues, how do they get the care in the community?
Primary health positions.
Yeah. Community nursing. All right, so the reason why this class is placed at the end is because in the community, a couple things. You can be taking care of any age group, right? pregnant moms, infants, kids. School nursing, I took care of kids from the time they were 3 till they were 19. You could be taking care of adults, disabled adults. You could be taking care of the elderly. So what kinds of classes might help you to be more prepared for community nursing that you've already taken? If you know you're going to be caring for clients across the lifespan. Geriatrics? Peds? Maternity?
Maternity.
Med-surg?
Pharmacology.
Pharmacology? Fundamentals? Right? So think about it. This class, we're pulling all that together. Because you will be caring for, if you decide to go into community nursing, you'll be caring for not only clients across the entire lifespan, but think of all the types of conditions and chronic diseases that you'll be caring for in the community as well. Whether they're pediatric patients with chronic conditions, elderly patients with chronic conditions, right? So this is where all your tools come together. So this class is designed for you to bring all your past knowledge from your previous classes, your past knowledge and experience, and now we're going to put it into practice in the community. Okay, remember your next gen model, right? We're taking knowledge that you've obtained and putting it now into clinical judgment, right? Next gen is all about clinical judgment model. So next gen is all about placing yourself in a situation of how do you care for a elderly client that has CHF in the home? If you're a primary care nurse, how do you develop education programs? Because a lot of community nursing is education. When I was a school nurse for 20 something years, most of what I did was education. Okay. So I would ask you, well, first let me ask another question. What horror stories have you heard about this class?
That it'll make or break you.
That's terrible. That's terrible. What else have you heard?
That the tests are hard.
If you study, they're not, but go ahead. Okay, keep going.
I've heard you either really understand it or you don't.
Okay. What else have you heard?
I heard that you were a really good teacher. Like you were recommended to me, even though I have you already.
Thank you. Thank you. I love what I'm doing. Hopefully you guys will see that. This isn't a hard class, guys. Okay, it's not. It's a 2-credit class, and all the work that's assigned to you is based on hours for 2 credits. I give this mantra at the beginning of every term. Okay, if you can just block out a little bit of time each week and get your community stuff done, work done, and then focus on med-surg and peds. It's not a lot of work. This is not a class to fail. This is not a homework fail class. I would ask you to go into it with an open mind, and you probably don't know a lot about community nursing. Just have an open mind and look at how things are done in your community. Right? Someday you might be some type of a community nurse. Okay, so just keep an open mind. Take off your clinical hats from wherever you work now. Just try and come focused for an hour and 15 minutes, 20 minutes that you are now working in the community. If you're an let's see, what have I had issues with? EMT, firefighters, police officers, they all take that knowledge and try and bring it into the community in the way they do things. Okay, just eliminate that for right now. Okay, but have an open mind. Okay, I get we have this conversation in week 1 where people don't know about community nursing, at the end, they're going, wow, wow, there is so much. Okay, could everybody turn on, everybody, I'm only gonna say this once, just keep your cameras on, okay? If you have to get up and go to the restroom or go get a drink, you don't need to put anything in the chat. Okay, just go do it. But I need everybody to be on camera. Okay. What else did I want to say in my intro? So next month, I'm going to be a nurse for 40 years. I know I'm dating myself, 40 years. And if you read anything about my bio, just real quick, I started out in military. I was a Navy nurse for 12 years. So I did Navy nursing. And then when I moved to Colorado, I was stationed in San Diego. And then when I moved to Colorado, I went into the hospital and became administration. I was director of Women's and Children's Services. My experience in the Navy was all women's and children. So L&D, NICU, PICU, all that. So I went into administration in Denver at a big hospital of Women's and Children's Services. And then from there, I went to the schools for 20 years. And this is my 3rd year starting Fortis. So now I'm in education on the tail end of my career. And this is exactly where I want to be right now. I love what I'm doing. I love my students. I love my student population. I call this giving back. I'm sure you guys are the new faces, going to be the new faces of nursing. Okay. So for me, this is give back. I'd like to help you with my own experiences, my knowledge, and give that to you. Okay. So I'm really into what I'm doing. Love teaching community nursing. There's so much to learn. What kinds of clients do you think of your own community? What kinds of clients do we care for in the community? I'll start. Homeless. Keep going. Elderly.
Disabled.
People with addiction.
Addictions.
Veterans.
Uninsured.
Veterans.
Veterans. Thank you. What about what?
Kids.
Children are
Women
one
and
of our children are one of our most vulnerable populations.
Women
about-
in abusive situations.
Yep. Domestic issues, domestic violence, human trafficking. Teen pregnancy, mental health. Just think of your own zip code. Think of when you drive around your community or wherever you work in your community. What about inmates in prisons? Are they a vulnerable population? Of course they are. Of course they are. So, community nursing is a big scope. Okay. And we're going to cover what we feel are the most important concepts. We will talk a lot about vulnerable populations. The other thing we focus on is rural versus urban, right? There's rural communities, right? And unless you live or work in a rural community, community nursing is real tough in those areas. Usually you're the only one. So we'll talk about rural versus urban. We'll talk about infectious diseases. I'm just trying to go through the syllabus. We'll go through it, but I'm just off the top of my head. We'll talk about infectious diseases in the community, communicable diseases. I mean, what have we been dealing with for 3 years?
COVID.
Public health catastrophe. And the roles of the community health nurse, the public health nurse, public health nursing in general have really been elevated over the last couple of years. Right? I know my role, the last couple of years I was with my school district and I was in a huge district. We had 90,000 kids, right? We had almost 200 schools. That's all I did the last 2 years was COVID. I was like a COVID nurse. Okay, so we'll talk about infectious diseases. We'll talk about environmental nursing, environmental risks. Think of all the risks in our community environmentally. Air, water, soil, food contamination, right? We'll briefly cover epidemiology and talk about how nurses in the community get involved in tracking things, tracking outbreaks. We'll talk about faith community nursing. That's another role that nurses play in the community. Does anybody know anybody that's a faith-based nurse? They're in congregations, whether your congregation is a temple, a church, a mosque, it doesn't matter. Faith community nursing exists. It brings a spiritual side to the community or to community nursing. We'll talk about occupational health nursing. What's occupational health? What does it focus on? The workplace, right? The abbreviation is OC Health, right? Occupational health nurses. They're responsible for the safety and well-being of workplaces, right? They're the ones that deal with workplace injuries, training for safety. If you're working with big equipment or loud equipment or an environment that has a lot of risks, that's what an occupational health nurse does. And then we'll talk about hospice nursing. Hospice nursing is part of community nursing, as is home health. Okay, so we're going to cover lots of different topics, but we're going to skim it. Okay, I realize that you guys have numerous chapters in your book. I get that. We're going to skim those chapters. Okay, we're going to pull out what information in those chapters, what knowledge in those chapters will support you in getting to know about community nursing. It is impossible to read every chapter from start to finish. All right, each chapter is a different concept, and we'll cover a few things from each chapter that we need to pull out. Okay, so I try and do very targeted teaching. Okay, and so I try and go through, like, if we're talking about environmental health, we're gonna go to that chapter. We're gonna pull 3 or 4 things out of there that you really need to understand environmental health. Okay. Study guides. You're gonna have study guides for all your exams. Okay, and last night I sent you the review schedule. You can see how many reviews there are, right? You guys, everybody get the schedule last night? Yeah, I mean, I think there's 7 instructors. So you're going to have 6 or 7 reviews for all 3 exams. And we try and put it together and give it to you in one document so you can plan for the whole term. And I know you've heard this in other classes, but there truly is a correlation with attending live review sessions and doing better on exams. So that's why we give it to you at the front end, to try and plan ahead. Right, so for exams are in weeks 3, 6, and 9, which means we'll have the reviews in weeks 2, 5, and 8. So that means that already next week is the review week for your first exam, because exam 1 will be in week 3 and it will cover weeks 1 and 2. Okay. The study guide should be coming out. We like to try and get the study guide to you as soon as possible before each exam. So, for example, you should have the study guide by the end of the week. Okay, the study guide is an excellent tool to start with, to start reviewing the exam. Okay, the study guide really hones it in, really focused on what you need to know for the exam. Okay. So review schedule, what else did I send you? For this week, we'll go through the module, but for this week on your professional development plan, right in the module, I gave you a template. So everybody seen that? There's a template in there. Please just use the template. I mean, you can do your own free writing, in a Word document, but it's so much more organized and easier to do if you do use that template. It's asking for long-term goals, short-term goals. What do you currently do? What are your responsibilities? And actually, honestly, professional development plans is by far my most favorite assignment to grade the whole term. I love to see what you guys are doing and what you want to do. Truly inspiring. So, and don't stress about your professional development plan. Just go in there. Maybe take half an hour, go in there and just think about what you do, what you want to do. Don't spend lots of time on it. Okay. It's asking you 6 targeted areas. Okay. It doesn't have to be 10 pages, 2 pages. It's just evaluating where you are, what you want to, what you're doing now, and what you want to do. So get it done. Okay. Get this work done early in the week. You guys are a Wednesday class. You know, maybe take a couple hours on Monday and get what has to be done. This class includes NCLEX. You have 4 NCLEX assignments. You have a professional development plan. You have, I think, 3 discussion questions. We'll look at those in the modules, but you have a vulnerable populations assignment, which is due, I believe, in week 9. That's the big one. That's the 8%er. Okay. So we'll introduce that, and then I'll introduce that in the next couple of weeks. But essentially, you are picking a vulnerable population within your zip code. All right. So homeless, teen pregnancy, substance abuse, whatever you want to learn more about in your own zip code. And you can start that as early as you want. I know it's due in week 9, but get it out of the way and get it done. What are the other big ones? You have a couple of HESI case studies that are already preloaded into your modules. You have 4 NCLEX. You have 2 group assignments. All right. I try and assign students from the same campuses in the same groups, so you can work together on campus if you're all there. You'll be getting group assignments by the end of the week, because the first one is due in week 3. So if you want to look ahead, the instructions for the 2 group assignments are in the weeks they're due. Well, actually, everything's in the weeks they're due. So vulnerable populations assignment, go to week 9. That's where you're going to get the rubric and the guidelines. Your first group project is due in week 3. It's a case study. So go to week 3 and look at that. There's 3 different case studies. I'll be assigning groups the different case study. A different case study. And then the other one to go read is week 7. That's your second group project. And that's an infectious disease project, where I give you guys an infectious disease, or you pick one for me and you do a group project about it. Please look at the rubrics. Okay. That's how I grade. And I am super easy to get. I'm just not, I'd rather have you learn. I mean, it's more important for me to have you guys learn than to be, I'm not going to be on you, I guess is what I'm saying. I'll remind you once if homework isn't turned in, otherwise it's just a 0. Okay. I'm super flexible where I can be. The one thing that has to be an absolute no-brainer is communication. Okay. If I don't know what's going on with you guys, if you're having issues, I can't help you. But if you do let me know what's going on, whatever is preventing you from being successful in this class, you got to give me a heads up. I'll work with you. I promise I will work with you to the extent I can. There's certain things I don't have a lot of flexibility on, like late assignments and all that. We'll talk about that when we get to the PowerPoint. But other than that, if you're communicating with me, we'll be fine. You know, this is a team effort. Everybody's going to get it. We have to get everybody over the finish line together. Okay. And again, this isn't a hard class. I think it's an interesting class because you look at a whole, you've been in clinicals, you've been in hospitals, you've been in facilities. This is out in the community. So look at it differently. Open your minds to learn about the community. And the other thing I'll say is, regardless of what kind of nursing you go into, you're always going to have contact with some kind of community nurse, right? Let's say you're working, you're working in a hospital and you're discharging patients. Well, you have to discharge the patient to the home health nurse, right? If your kids are in school, you see a school nurse. You're always going to have some connection to the community, whatever area of nursing you're in. Does that make sense? Okay, so that was my intro. So what questions do you have before we jump to the PowerPoint? Hey, Michelle, can you turn your camera on? Oh, there you are, Michelle. I had you in 2 places. Okay, yep, gotcha. I gotcha.
Oh,
I gotcha. You're signed in 2 places. What questions do you guys have? As far as making or breaking, like who said that? Was it Jasmine? Who said that? Kiki. Kiki said that. This class can make or break you. Well, it's kind of what you want to get out of the class, right? I'll meet you halfway, but you got to do your part too. Right? Community nursing, I just think it's a super interesting, different perspective kind of class. Okay. Questions? We'll go to the PowerPoint. Nobody has any questions.
you gotta go that way for now.
What? Not one question. Okay. All right, let's go to the PowerPoint. I'll try and go through this as timely as possible. Then we'll look at the syllabus and we'll look at the modules and then we'll be done. Okay, but because we're doing orientation this week, you guys are responsible for week 1 material. I've sent it all out to you in your announcement. Okay. All right. Let me share my screen. I need to go to my, excuse me. Oops. Where is my, sorry, let me go to my, I can't, because I don't know how to, maybe I can, hang on. Nope. I'm usually technologically challenged. Oh, there it is. Okay. RN PowerPoint. Okay, you guys see that? Yes? Okay. So this is the PowerPoint that all professors have to go through with each class. At this point, you guys know what online learning is, correct? We don't need to review that, correct? Right? This is a hybrid. Okay. You got to make sure you have a strong internet. If you don't have a strong internet and it comes up to exams, we'll get to this in a minute, but take exams on campus. Okay, and we'll talk about how to do that. The course includes weekly homework, assignments, learning activities. I like to do case studies. You know, we'll try and do lecture we'll do a little bit of a lecture at the beginning, and then we'll do some kind of a group activity, whether it's a case study or NCLEX questions, maybe a Kahoot. Okay. Who to contact. Okay, so this is an important slide. I think it's slide 3. All right, so always start with me. If you have an issue, start with me. If I can't help you with it, I will reach out to our course lead, who is Dr. Lundy. Okay, if Dr. Lundy and I can't help you, we will reach out to Dean Brown. But you all need to have Dean Brown's, sorry. You all need to have Dean Brown's information handy in case you need to contact her. And it's found in one of 2 places. It's found on slide 3 here at the bottom. And it's also found on my instructor page in your course shell at the bottom. Okay. I can only help you with our online class. I can't answer questions about sims, labs, clinicals. Okay. That is for your campus instructor or campus dean. If you have any issues with your schedule, that's campus or campus dean. But I can certainly help you with anything with regards to this class, or do my best to. Okay. So let's see. So I'm your first contact. Second is I'm available several ways. Email. You guys have my email. Everything's in my instructor page. My email, my private phone number. You have my personal cell phone number in my instructor page. I have no problem if you call or text me. Okay. If you text, that's fine. But just identify who you are and what class you're in. Okay. I'm very timely about responding to emails, phone calls. If you have to leave me a message, I'll call you back. I hope that I provide you with a good overview of community nursing. And during the course, I would like to provide you with suggestions of how you can improve your performance. I will offer one-on-one tutoring after all the exams to see or to review your exams to see what you got wrong. Right. And that's where we talk about test taking strategies and anxiety going into tests. And we talk about how we can improve your performance. So I'm available for that. I try and give detailed, specific feedback in your assignments. Okay. I do believe I am very experienced in this content area of community nursing. And we know that an online course is a professional setting. Communication is always to be respectful. One of my first emails or announcements to you was about etiquette. I don't typically have any problems in my classes. I just don't. Okay, so you guys are seven terms in, right? Etiquette, online etiquette should not be a problem, right? I really like for it to be an interactive, participatory class. I ask a lot of questions. I don't pick on people and call out by names. I just don't. But I like people to participate. Okay. So when you're talking, courteous, positive, respectful manner, keep comments relevant to discussion topic, be considerate of others. I love when people share their experiences. Love when people share their current work experiences to what we're learning about in community. And if you're angry with me or upset with me or want to give me some feedback, I love feedback. I love feedback all through the term. You know, Professor Marvel, you went way too fast in the last class. Could you slow down talking? You didn't really cover the topics that we were supposed to cover today. Can I set up a one-on-one tutoring session with you so I can better understand the content you provided today? Okay, I love feedback. I can change mid-course if I'm not meeting your needs. Okay, so please give me feedback. You guys all know this course is Wednesdays from 1 to 2:40 Eastern time. Okay. I kind of made an executive decision from last term when we shortened it up 20 minutes that I think we can make it through an hour and a half without a break. And that way we can be done 10 minutes early. Right. So I know it's an hour and 40, you get a 10-minute break. So let's just plow through to an hour and a half and we'll be done halfway after the hour. Does anybody have any issues with that? Okay. If you have to get up and do whatever, just go do it. Treat these classes online like you were on campus. I mean, you're expected to be there from start to finish. If you're having issues, just send me an email or put something in the chat. But if you don't attend, it's a 0 for attendance. And you know, we'll get to the attendance policy, but just for an hour and a half a week, come to class. Okay, we know about discussion boards, right? You have a few of them, and we know that discussion boards, the initial post is due on Wednesday, and then your peer responses are due on Sunday, right? Other than discussion questions, everything else, the initial posts and your group projects, they're all due on Wednesday, but everything else is due on Sunday. But don't wait till Sunday night Don't wait to Sunday night and shoot me an NCLEX assignment with a score of 30. All right, take your time on the NCLEX, and we'll talk about that. Take your time. I'm just going to say it now. Take your time on the NCLEX assignments. They're not there to make extra work for you. They're there for you to learn. I truly believe anytime you can learn from rationales is an unbelievably successful way to learn. Right? So what happens when you what happens when you take your NCLEX the first time and you get a 25? What should you do? Submit it? You do know you can take the NCLEXs as many times as you want, right? You can only submit it once. So if you're taking an NCLEX and you're submitting a 25, that tells me you probably didn't read the rationales. You just went through the motions. So what I'm going to do is anything below 40, I'm sending right back to you. And I'm going to put a comment in there. Hey, I have reopened this NCLEX assignment for you. If you would like to redo it and submit for a better grade, please feel free. It's up to you. I want NCLEXs in between 45 and 50. I mean, you can turn them.
Do you mean percent or questions correct?
What?
Do you mean percentage or questions correct? When you say
Questions
40,
correct.
okay.
Questions correct. So if you turn in, you got 49 out of 50. I have no idea how many times you did it to get to that 49, but I do know that whatever you got wrong before that, you were reading why you got it wrong, right? So take your time to do your NCLEX questions. You guys all know about the late policy. It's the same in every class, right? Anybody not aware of what's on this slide? It's three things. One is if you're going to be late, you got to let me know. All right. So next Monday morning, if I have 5 professional development plans that are not turned in and I haven't heard from anybody, it's a 0. You don't have that 1 to 7 days, because here's the top part of it. It's only with prior approval. And that tells me you're letting me know something's going on. Does that make sense? Of why you're going to be late. But if you just don't turn in your assignments, it's a 0. Okay. If you've let me know, then you have that 1 to 7 days. You're still going to have to take a 10% deduction, but at least you have another week to do it. And then after the 7th day, nothing can be accepted. So at the end of the term, I had a student last term that the weekend before HESI turned in all 4 NCLEXs, and they were due in likes week 2, 5, 6, and 8. I couldn't accept any of them. All right. Attendance. What questions do we have about attendance from last term? You know, you come to class, everybody's fine today. Don't worry about it. I was late. You come to class 5 minutes late, you're going to get docked 15 minutes, right? You come to class 35 minutes late, you're going to get docked 45 minutes. It's done in 15-minute increments. If you're chronically late, that's going to add up throughout the term. Okay. So everybody's perfectly fine today on camera with their names, whatever. Didn't have no issues with that. Remember, you guys know the 14-day rule, right? If you haven't logged in 14 days or you missed 2 classes in a row, you're an automatic drop. Everybody knows that, right? Okay, you've heard all this before. Let's see. Attendance is done. Yep, we do it differently now. Early departures, tardies, class cuts will be recorded. I get a report after every class. It's generated for me about who was in class, what time they logged in, what time they logged out. Okay. And then it gets, once I submit that, once I check it over and submit it, it's sent right to your registrar. I have nothing to do with it. Okay. All I do is track it. And then students are considered chronic absent with absentee issues if you're above 20%. You can get to 20% really quick. Missing a whole class is, I think, what was it? I think it's like 8.33%. So you miss a couple of classes, you're getting close to that 20%. And here's a little breakout. If you're at 5%, right? I'll be emailing you, say, what's going on? You've been late for the first 3 classes, even though it's been only 10 minutes, this is going to add up over the term. And then there's 10%. You'll be required to meet with Dean, if you get to 10% and it's cumulative, you'll have to meet with Dean Brown and myself. If you're at 15%, we're going to have to pull in Dean Brown again and pull in your campus administration. Okay, so the level of intervention will be relying upon how much time you've missed. Okay, so really no need for that. If you're having an emergency and things are going on, let me know and I'll work with you. You should already be practicing these 7 keys to success. Okay, review the work, see what's due, complete the work, turn it in on time. Okay. To be successful, stay connected with me, have a reliable internet, maintain your schedule. This is a tough term for you guys. I fully acknowledge that with 3 classes. 2 of those classes have in labs, clinicals, and sims. If you ever needed to put your time management skills and organizational skills in play, it's this term. Okay. Identify a quiet, free place from distractions to complete your work. Read all assignment directions carefully. That's your rubrics. You know, this is the announcements is my communication with you. So check them. I don't know if you guys get alerts, whatever, but I would log into class 4 to 5 times a week. All right. I'm posting stuff pretty frequently. Make sure you know when all the assignments are due. I like to review assignments for the next week. So we'll quickly look at module 2, week 2, and see what's due next week. You already know how to get started because you're all here today. Come to class prepared. The expectation is that you come to class prepared. When I start asking, okay, guys, so what are we going to cover today? And nobody knows, it tells me nobody's prepared for class. You know, at least just review the information and look at the topics we're going to be covering. Okay. I sent you a syllabus cover sheet, one of your announcements, which has office hours. This term, I schedule my office hours for the hour after class. But schedule it, if you want to meet with me, schedule a time with me. Now, that doesn't even include all the tutoring sessions and all the exam reviews I do. That is above them, that is separate. Once you get your first exam, I'm going to send out a schedule of 20 opportunities to meet with me. Monday, Tuesday, Wednesday, Thursday, Friday, all the different days and times. Okay, but office hours are office hours. If you need to talk about something before class, please let me know, or after class. Okay. We've talked about all of this. That's tutoring sessions, exam reviews. Here's the breakdown. If you haven't looked at the syllabus yet, you've got 3 exams we talked about. You've got your HESI, 20%. So the KGAs are 80%, right? And then the homework is 20%. Okay, here's your big one, vulnerable populations, week 9, 8%. Your professional development plan that you're doing this week, 2%. Your first group project, which is your case study, Healthy People 2030, 1%. You get 4 sets of NCLEX questions. Okay, each worth 1%. 2 case studies, each worth 2%. You'll have a next gen case study at the end. I think that's week 10, 1%. And then the rest is pass fail. And we all know the rule of thumb, right? You have to be at a 78 for after your 3 exams in HESI for your homework to count, right? You guys know that, right? Yes. Okay. At some point during the term, usually around week 6, I'll turn on homework grades just so you can see how your homework is affecting your grade. If you're turning, I don't usually have an issue with homework in any of my classes. I mean, I have occasional students that are not doing their homework, but for the most part, I try and stay right on top of you with homework. Okay, so your homework grade should be adding to your KGA grade, not lowering. We all know what a homework fail is, right? This is not a class to take a homework fail in. There's just not that much. Okay. That's your 78%. Does anybody need me to explain this this slide. And I only asked that, and I don't ask that flippantly. I asked that because I had a student last term that finished out with like a 77, which was below KGA. And she just made the assumption that her homework was going to get added in. It was no big deal. Her homework was not getting added in because she didn't have a 78. She said, I've never heard that. I've never heard that. I said, you're in your 7th term. Of course you've heard that. Anyway, she didn't pass the class. So exams. What do we need to talk about with exams? We do them in class. Your exams will be Wednesday afternoons at this time, right? They're done through ExamSoft. I would encourage everybody between now and week 3 to just double check their ExamSoft. Make sure it's working, make sure nothing's been disabled, just give it a check. All right. Obviously 1 attempt. What do we do if you're having technical difficulties during the exam? Stop, right? Stop, let me know. I mean, I give you my phone number before each exam, call me, text me, whatever. Okay. Oh, couple things when I read this first bullet. I need to know if anybody, I know I sent you an announcement. I need to know if anybody's a re-entry student, a repeat student, or if anybody has accommodations. If you have accommodations, I need you to send the documentation to me because I have to send it on to Dean Brown and it needs to get reapproved every term.
I'm a re-entry student.
Just send me an email.
Okay.
Welcome. Yes, send me an email. Yep. So accommodations need to be approved every term. It may be the same paperwork we can use, but it has to be approved. There is no switching exams unless it's a true emergency. Okay, so exams are held during our scheduled class time. Exceptions only with written approval submitted to me. So last term I had a student that went into preterm labor. Of course, she had the doctor's note, sent it to me, and we worked with her exams. Okay, but there's no, we have a med-surg exam on Wednesday as well. Could I just take it Friday? We're not doing that anymore. Okay. I mean, we never were supposed to be doing that. We're just enforcing the policy now. Okay, so you got to take the exam on this day at this time, unless you and I have talked about an extenuating circumstance. Okay.
I have a stupid question.
No question is stupid. Go ahead.
So on the exam days, are we having lecture after the exam?
No.
Okay. I just wanted
Because
to
I
clarify.
inevitably have somebody with accommodations that take longer to do the exam. And now that the class is only an hour and 40 minutes, students are, and you have an hour and 15 minutes to take the exam, we're usually right at the cutoff. Does that help? Yeah, we're not coming back. Okay.
I figured, I just wanted to clarify.
Yeah. You guys know about Zoom, right? For exams, you got to show your photo ID. Yeah, we'll go through that when we get to the exams. Don't worry about that. Missed exams will be held to the late work policy. Now, if you just don't show up to take an exam, it's a 0. Okay. If you miss the exam for personal reasons, you'll have to take, for whatever, you'll have to take a 10% deduction. Right? But any exams missed due to emergencies will require documentation submitted to Dean Brown and will approve for you to take it on a different day. Okay. I can't help if you take an exam and you don't do well, and then we meet and you say, oh, I had so much going on and this and that. I can't help you if you've already taken the exam, but I can work with you if you haven't taken the exam yet. Does that make sense? So I really, really need some communication. Okay. Contact me if you have any problems or you just want to, you just need any additional help. Homework assignments. What do we want to know about homework assignments? Everybody has their own way of organizing, whatever you use, calendars, phones, whatever. But this is a good time to be real organized this term. Late work policy, we already covered. Have to have pre-approval from me, and then you get the extended week. after the 1 week, it can't be turned in. Okay, I promise you, I will do my best, and I usually don't, this isn't an issue for me, but I will have everything graded by Tuesday. All right, I will actually start, I grade 7 days a week. All right, if there are assignments that pop up on my dashboard, I'll grade them. Okay, the discussion questions I have to be a little careful about, because if you've done the initial post on Wednesday, but then don't do the peers until Sunday, I have to wait till Sunday. But you know, if by Friday you've done the initial post and your peer reviews, I can start grading those. I like to grade ahead. I like to stay on top of grading. Okay. NCLEX. Everybody knows how to get into NCLEX, right? Let me make a blanket statement. Please start every assignment in this class from your module. Go to the links in your module. Okay. So in all your NCLEX links, you should, it's already listed in your module that what you have to pick for categories. Right? And I think your first NCLEX, I believe, is next week. Is that right? Week 2. Right? Okay, be careful about working ahead. Don't go too far. All right, because I don't want to have to put, I know there's some professors that only open up the assignment the week it's due. I don't, just be careful about working ahead. You have enough going on with med surg and peds. Okay. And plus the weeks that the NCLEX, you have NCLEX, we cover your NCLEX categories in class. So I just caution you about working ahead. There has to be 2 things submitted for attendance every week. 2 things. One is always going to be the attendance at the live lecture, right? But the second one is an assignment. And there are some weeks that there's only one assignment. Like there's 1 week, I think you only have live lecture and the NCLEX. All right, if you submit the NCLEX way ahead of time, then you're not going to get credit for that week if you show up for class, because you don't have your 2 entries. So what I would suggest you do, if you want to do all your NCLEXs ahead of time, just don't submit them till the week they're due. How's that? You can put them in a holding pattern, but don't submit them until they're due. Does it make sense? And here is my mantra about you can repeat it as many times as you want, but only score it. You can only submit it once. Okay. I can't accept PDFs for anything, especially NCLEX. If you submit, no, let me take that back. I can't accept a screenshot of anything, including PDFs, a screenshot of a PDF for NCLEX. It has to be the whole 12 to 16 page category detailed NCLEX. So I can go in and make sure that you've covered all the categories that you were asked to. And when you have to submit me a screenshot, that means you didn't go through your module link to NCLEX. You went into like elsevier.com or whatever. All right. So, but the point is I can't accept screenshots, and I'm going to send it back to you. HESI we'll talk about down the road, but just know that all of our content is done in week 9. Done. We're all done with lecturing content. Week 10 is focused on HESI review. So this class during week 10 will be an hour and a half of HESI review. Okay. And you'll have the opportunity to go to any other sessions you want as well. Okay. And then week 11 is HESI. So all of week 10 is focused on HESI review. Okay. We'll be sending out, once we look at last term's HESI and see if we have to change any of the information in our study guide, you'll be getting a pretty big study guide that's called a HESI study guide. And you should be looking at that through the term. Okay, it's like a book. It's like 50, 60 pages. So if you open it up the day before you take the HESI, it's going to be overwhelming. But if you're continuously looking at during the term, you'll be ready. And everything in that HESI study guide are topics that they're asking on the HESI. I don't know the questions they ask on the HESI because the HESI is treated like an NCLEX. They pull the questions from a big bank. But I do know the topics that they're asking about. So we make sure those are covered in the study guide. Okay. Writing papers, APA, please. APA format. Anybody in your student resources, there are plenty of material, there are plenty of resources about what APA is. I have a little cheat sheet. I'll send it out to you guys this week. I'm also going to send you some math resources for any of you that struggle with math. I have some really good little cheat sheets of how to, quickly put together formulas and calculations and conversions. So I'll send that out to you. I didn't want to bombard you everything in week 1 and not know where all this was coming from. So I wanted to tell you ahead of time I was going to send them out. So I'll send you out APA, I'll send you out math resources, and I'm even going to send you some test taking tutorials that I found in our instructor resources in Elsevier Evolve. All right. So you do what you want with them. I'm sending them out to help you. If you struggle with math, I would suggest you look at these. If you don't struggle with math and you're doing fine, then don't worry about it. Always find your rubric for whatever you're submitting, right? Your rubric is how I grade. So if you say to me, well, what's supposed to be on my professional development plan? Look at the rubric. Okay, that's what I pull up to grade. This is about APA, taking exams. What more do we need to know about taking exams? We know all that. Technical issues do not continue. Specialty exams, that would be our HESI. We know that it counts for 20%. We always encourage, the benchmark is 900. Dr. Lundy makes us all tell you guys that we shoot for 1,300 on the HESI. We talked about 1 attempt for the HESI, Proctor, we talked about all that. That's it for that. Anybody have any questions? You have a copy of this, right? I sent that to you in an announcement. So you may need to refer back to this during the term. Okay. Hold up our class. Here we are. Okay. So this is what I've sent to you so far. Go up here. Healthy People 2030. This is in week 1. Have a look at Healthy People 2030 website. Healthy People 2030 is a national initiative. It started back in the 80s. So we had Healthy People 2000, 2010, 2020, and now they just introduced Healthy People 2030. And that's where these case studies come from in that first group project. Okay, this is an excellent resource about there's exam questions about Healthy People 2030 on every single exam. But as you'll notice, as we go through the term, every single chapter in the book that you're assigned to has a Healthy People 2030 box. So let's say you're in the chapter of epidemiology. You're going to have a Healthy People 2030 box that said goals and objectives of Healthy People 2030 goals and objectives for epidemiology. Healthy People 2030 goals and objectives for hospice nursing. All right, so that's one thing you're going to need to review in every chapter. And we'll get there when we get to lecturing on content. But know that there's a Healthy People box in every chapter. And the goals and objectives are different because each chapter has a different topic, right? So you're going to have to be familiar with those. Ebook. I did see a couple of you did not access the ebook information yet. So if you haven't accessed the ebook, you got to get online and do that. Has anybody had any problems getting their book uploaded into the library? If you have, email me. Okay, this one is your etiquette. This one is kind of the nuts and bolts about the class. There's your syllabus cover sheet. Dean Brown sent you a message. Here's your orientation PowerPoint that we just covered. I think schedule changes are up to Friday to request any schedule changes. I believe, what was the 14th, right? So if you need any schedule changes, you only have till Friday. Okay. And I don't think there's going to be anything allowed after that. Here's your schedule I told you I sent you out. Okay, with all the reviews. So for example, next week, if you have a look at this, exam 1 is in yellow. There are 1, 2, 3, 4. There are 4 exam reviews for next week. Thursday, Friday, Saturday, and Wednesday. So Wednesday, Thursday, Friday, Saturday of next week. Okay, here's all the Zoom codes for all the different professors. You can attend 1, you can attend 4. Okay. And then our last announcement was, oh, that I'm going to be late for class. So there's your announcements. Let's just go through the syllabus real quick. You can go through and read the course objectives, course description. We kind of tried to put that in our week 1 announcement. Okay, student learning outcomes, course objectives. You can read through that. There's your textbook. You have a great reference package. And one of the things in your reference package is right here. If you struggle with math, calculate with confidence. Have any of you guys ever used that? It's fabulous. There's your math reference book. Okay. Then we talk about, here's your grading components. We already went through that in the PowerPoint, so I'm not going to review that. Okay, but you can refer back to it. Key grade assessments, HESI, course activities that are not key grade assessments, that's your 20% of homework, right? Your late work. Here's the expected hours with a 2-credit class, 60 hours. Okay, above and beyond lecture time. Okay, and then here's the course outline. If you want to look ahead, what are we covering in week 1? Okay, what are we covering in week 2? I mean, look at all the things we're covering. I know there was things I missed. History of public health nursing, evidence-based practice. We talk evidence-based practices in the community as well, right? We're always trying to get the best research, the most updated information, the most current information to provide patient care, right? Just like you do in the hospitals. Well, that's also in play in community. Vulnerable populations. We talk about vulnerable populations the whole term, but you have a little introduction. Okay, to vulnerable populations, your healthy people 2030. So if you look at this, is all broken out weekly into 3 sections. What are we going to cover? What should you be preparing with? And what's due? And the one thing you get every week is PowerPoints. What are PowerPoints? PowerPoint, you'll get a PowerPoint for, you already did, get it for chapters 1, 2, 3, 9, and 23. PowerPoints are simply a summary of the chapter. It's not above and beyond the chapter. It's a summary of the chapter. Right? So if you go to each chapter, if you go to chapter 1 and look at the outline at the top of the chapter, if you look at the outline of the chapter, that's your PowerPoint. That's how we build a PowerPoint. It's not additional information. Everything's connected in this class. It's very well organized. All right. As you're looking at, I'll just give you a heads up, so we'll start talking like this next week. My suggestion, take a look at the chapter objectives. There's usually 4, 5, 6 of them. That's what you need to be able to answer as we go through each chapter. So as I do my teaching, I'm answering the objectives. So I'm going into the parts of the book, parts of the chapter that answer the objectives. Because at the top of the objectives, it says, at the end of this chapter, the student should be able to articulate, describe, whatever the verb is. So when you go start reading, when you go to start looking at these 5 different chapters, start with the objectives. A lot of times, the wording in the objectives will match something in the course outline, and you can click right on it. It's hyperlinked to everything. Does that make sense? So the objectives are what we need to answer to understand the concept. So start there. Okay, and then again, week 2, we cover school nursing, family health risks, common childhood ailments, safety concerns. The next week, I'm not going to go through all of it, but you can see all the populations and the topics we're going to cover. All right. So if you look, I really would like you to look at the syllabus, but please look at the weeks and what we're going to cover. Everything's right there for you. In fact, most of my announcements I send you weekly are copy and pasted right from the syllabus, so as to not confuse you. It's just having you look at it in another spot. Okay. Anybody have any questions about the syllabus? Then the last thing I want to cover was modules. Okay. You guys have a ton of resources in your student resource section. I don't know. I actually sometimes use student resources as well. You guys have a ton of resources in here. Fine to ask me questions, ask me anything you want. But if I think it's covered in the student resources, I'm going to send you right back to student resources. Make sense? Utilize what you have. So so this week, if you haven't, you need to complete your literacy check, your syllabus quiz, and your ebook registration. And then here's where my pages, all right, with my biography, if you want to read it. What are we doing this week? Okay, we're doing orientation, but you already have an announcement with all your week 1 readings, right? And what's due this week? Your professional development plan. So that's where you click on to get what the instructions are. And that should be where you have your template, right? Right here. There's your template at the bottom of the box. Super easy. And then there's your rubric. Super easy. This assignment shouldn't take you more than 20 to 30 minutes. Where am I? Okay. And then next week, what do we got going next week? We have a discussion question. So next Wednesday, you're going to have something due, right? Those initial posts. Okay. And then next week, you're going to have an NCLEX. Okay. And then here's where it says the instructor will make group assignments for your upcoming course week. Well, since you have your first assignment due in week 3, I will have you the groups by this weekend. So if you guys want to reach out to each other, get going on your project, it's a case study. And you all pick a different part of the case study you want to answer. Super easy. The time is getting with each other and getting people to respond and splitting up the assignment. Once it all comes together, it's great. And why do we do a couple of group assignments? Why is group work important? You
To
guys
get
working?
different perspectives.
Yeah. And when you work out in the nursing field, you're working in groups. You're working with other staff members during the day, communicating with physicians and therapists, and right? Group communication. Then what do you do if somebody doesn't participate? How do you handle that? How do you communicate your frustrations? Group work is important in nursing. Nursing's teamwork. Okay. So next week you have NCLEX, you have a discussion question. Hang on, let me check my notes. I want to make sure. Oh, case studies. I'm going to my assignments page here. I know you guys don't see it like this, but this is how it's set up for me. So if you go to your HESI reviews, okay, you have one due in May, your hospice, I think it's like week 4, I think. I'd have to look at May, and you have a disaster, which I think is in week 7, but it would be in your modules. Anyway, it is due the week it's in your module. Okay. I have to extend these out 1 week. All right. So even though the due date is a week out, so let's say your hospice is due in week, well, let's go look and see when hospice is due. I think it's due in week 3 or 4. Case, no, 3 years your group assignment. Okay, so here's your first case study. Okay, it's in week 4. So it's due by that Sunday night, right? You're going to see the due date extended a week, because what happens with the case studies is if somebody's late, the case study's cut off. Like you can't, there's not even a week to do it. Does that make sense? So I have to extend it out a week so that people who are late, if they choose to be late, can still have access to it. So be mindful of that. Case studies are due in week 4 and week 8. All right. But you'll see the dates extended. Okay. Reentry, repeat accommodations. I covered everything for you guys. So anyway, again, if you want to see like vulnerable populations assignment, you know it's due in week 9. Here's all the guidelines here. The guidelines and rubrics are provided in the week they're due. Okay, and then week 7, here's your infectious disease second project, even though it says group project discussion. In the second one, you have to do a peer review. How'd your group do? So if you want to read about it, it's here. I had a couple of groups last term that did both their week 3 and week 7 together. Meaning they did group 3 or they did the first one and then they just decided to let's get the second one done. And they were done with their 2 group projects by the end of week 3, which is fine. Okay. I think, where are you guys? There you are. That's what I want to cover today. We did the PowerPoint, my little whatever mantra, whatever you want to call it, syllabus and modules. What do you think? Too much information, too little information? I talked too fast, I talked too slow, I was late. What do you think? Can you just sit back and enjoy and learn about what happens in your, I mean, your community gets taken care of, right? You may not think of it. Like, do you ever think about the environmental risks in your community? If you live near an airport or you live near a lake or water or railroad tracks or industrial, do you ever think of the risks? Or somebody else thinks about that for you? You go to a restaurant, right? You just assume everybody's preparing your food, right? The right way? Well, what happens if there's an outbreak of salmonella? Yeah, you know, I just take for granted. I don't so much anymore since I've been teaching for 3 years in the community, but we take for granted that our communities they just mosey on every day, right? We don't really think about safety risks or what about, we do a little section of a lecture on disasters. The community nurse, public health nurses' involvement in disasters is huge. Whether it's preparation, education, response, after effect, bioterror. We talk about bioterrorism. What if there's an anthrax threat or a sarin threat? You out there in the community nurse is going to be expected to participate in disaster drills or actual disasters. So there's a lot of responsibility that goes out into the community. And you're pretty autonomous. That's the other thing. Next week, we'll talk about the difference between community or come to class next week prepared to answer this. What's the difference between community-oriented nursing and community-based nursing? I'm not going to tell you now, but you'll learn a lot reading about that this week. Okay. I think community nursing rocks. Community nurses rock. You're much more autonomous than you are in the hospital setting, right? You're kind of out there. Of course, you have resources behind you and physicians you can call, but in the hospital, you have everything right there. I mean, think about going into a patient's room, But think about your clinicals, your med surg clinicals. You go into a patient's room and do your assessment. Think about the community. You're going into somebody's home. What do you do if it's uninhabitable? What do you do if they don't have money for medication? What do you do if there's abuse going on in the house? You're going into their home setting. Hospitals and rehabs and assisted care, they're pretty controlled environments, right? But when you're when you're in the community, remember, community nursing can be either you're caring for an individual, you're caring for a family unit, you're caring for a group of people in the community, say the homeless, or you could be caring for the whole community. Maybe you're responsible for diabetic education in your community. Right? So your clients, either it's going to be an individual, a family, a group, or the whole population. That's a pretty big span. Right? So that's my week 1. What do you guys think? An hour and 20 minutes later, what do you guys think? Yay,
think-
community! Yay, community nursing! Yay!
I think
What do you-
I'm not as scared now about
Who
the
said that?
class. Right here, Bree.
Oh, okay, good. Thank you.
Yeah, I'm not as worried about it now that you kind of went
Great.
into what it actually is. Because I'll be honest, I didn't know what this class was
Oh,
before
good.
I came. I mean, I just didn't.
Do
But
you have a better
it
understanding
doesn't
now?
seem. Yeah, it doesn't seem that bad. The only thing that I do like question, so is our local hospital, is that not part of community nursing? Or
No,
I guess
mean,
I
they're
am kind of
inpatient,
confused on
right?
that one.
Well,
Yeah,
think about it. Okay, if you're working in a hospital, you're not caring for that patient in the hospital's in the community. What we mean by community is you're taking care of patients in their homes,
okay,
out in the community.
okay.
Okay. I want to hear from Kiki because she said this class is going to make you or break you. So is this class going to make you, Kiki, or break you?
It's all about me and what I make out of it. So
Exactly.
I'm with Bree.
Exactly.
I'm definitely a lot more less nervous now
Thank
than I
you.
was.
Thank you. Thank you. So you guys, you're going to get what out of exactly. You're going to get what you put in. If you don't study for exam 1 and you do crappy, you're going to be behind all term. Okay, I'm going to have to present you at risk meetings every week to your deans because all the professors have to do that. Anybody that's below a 78 on a weekly basis, starting in I think week 3, we have to send weekly reports to your deans. Okay. I'm almost done, guys. I'm almost done. Hang on. Go ahead. We have to send weekly reports to your deans. So if you're below a 78 after exam 1, you don't get a chance to improve your grade until exam 2. And excuse me, you guys, I'm sorry. Let me get these two. You're not going to have a chance to improve your grade until week 6, right? So don't get behind on the first. I say this every term, but I always have a few outliers. Don't get behind after exam 1. It's going to take you forever to catch up. All right. And it's not hard to catch up. I mean, you just make it harder on yourself. If you get when you get the study guide, if you can articulate and not memorize, but if you can put the study guide into practice in your clinical practice, you will ace the exam. But you got to do your part too. And typically when I meet with students after exam 1, they haven't done well, they say, I was focused on med surg. I was focused on peds. I was, you just carve out a little bit of time each week to get your community stuff done. And then it's over. You don't have to think about it. Go focus on your other classes. Okay? I can't stress that enough. Just do the work, turn it in on time, use your study guide for the exam, and you breeze right through the class. But once you get behind and not turn in stuff and don't study for exams and you do crappy on exam 1, it's just going to be an uphill battle. I'll meet with you. I mean, I'll meet with anybody anytime they want to meet. If anybody needs tutoring before the exam, if anybody needs tutoring after the exam, anybody wants to meet weekly, whatever you guys need, whatever I can do to support you passing this class. You don't want to repeat this class. That's the 3rd time I've said it. There's no need to fail this class. Okay? And I'm super easy to get along with. Just stay in communication with me. I'll do whatever I can to help you, to support you. All right, we all got to get over the finish line together. We're not leaving any soldiers behind. Okay? Oh, let me just double check. Campuses. I have this group as either Cookeville, Cutler Bay, Pensacola, or Port St. Lucie. Are there others? Everybody's from one of those campuses.
Westerville.
Westerville.
I'd say, yeah, there's like a Westerville, Columbus
Oh,
one.
so we have Columbus?
Mhm.
Okay.
Yeah, there's 4
AZ.
of us.
Okay, AZ, where's AZ? Is she in there? What campus is AZ from?
Azzy,
AZ,
she's from Cookeville.
Cookeville. I don't usually get my formal roster until like week 2. I need to know things up front so I can start working on groups and stuff like that. And who else? I think she was the only one that I didn't hear from. Yeah, everybody else I know. Okay. Okay, questions? Helpful? Everybody's taking a chill pill and we're all gonna be fine, right?
Yes, ma'am.
Great. I'll stay on for any questions you guys might have, or if you want to meet with me one-on-one or whatever. It's really nice to meet all you guys. It's going to be by the time we look back, we're going to be in week 8. I promise you, it goes that fast. You guys are so close. But I can't wait to read your professional development plans. Love to see what you guys are doing. It's really, actually, it's quite inspiring for me as a old nurse. So, all right, well, I'm going to stop the recording. I'm done. I will